I would say an opioid is a narcotic.
It's used to treat pain.
We got oxycodone, heroin.
Medications prescribed by doctor's appointments, illnesses, injuries.
Something that people may get addicted to.
That basically people can't control when they're taking.
Something I want to stay away from.
An opioid is any substance that reacts or binds to opioid receptors that are located in the human body. These include morphine, OxyContin, oxycodone, and there's a much longer list of these opioids. Not only do they treat pain, but they also cause euphoria. Unfortunately, that's that good feeling that attracts people back to the medication. Anyone can become addicted to these medications. Opiates do not get rid of pain, they only suppress it.
People think of these problems as big city problems, but they're not. They're here, they're in our community, they're in our small town.
Anybody who has an acute pain problem that's prescribed opioids and finds that they like the effect of the opioids is at risk. About 10% of patients, 10% of individuals actually have some difference in their brain chemistry that we don't fully understand. They actually feel better taking it. Probably at least half of the time people started taking medications that were someone else's medications. So sometimes mom or dad, grandma, grandpa for younger people. But increasingly, because of the concerns of how they can be misused, we ask people to make sure they have them secured in their home, preferably in a locked box, and they have the responsibility of taking them as prescribed by their physician.
In Columbia County, opioids are a big problem. I think they're a big problem everywhere.
I think we're in the middle of an epidemic.
People are getting addicted to them. They are too easy to get a hold of. A lot of people are overdosing because of them.
A lot of times the result is crimes are committed.
They're a bigger issue in our schools.
More and more people are doing them or getting pressured.
The bad deal is it seems to be getting worse rather than better.
I think people just aren't very aware of it.
It has reached every corner of our county. It has infiltrated our schools, our homes, our businesses. For example, we've had 57 people die in just the last 5 years from drug overdose. The trend that we're seeing now is that the opioid problem is in homes that we would have never expected. We have seen a huge link between prescription abuse and addiction to painkillers transforming into heroin addiction. As doctors are cutting off some patients, as it's getting harder to get prescriptions. We see overdoses a couple times a week, but we see the heroin impact daily in our law enforcement careers. As a father of 3, this opioid problem that we're seeing in our communities is real.